athenaOne provides physician practices and healthcare organizations with a seamless experience, from patient engagement through the clinical encounter until you're fully paid. We blend modern, dynamic technology with empowering insights and expert teams that take on work on your behalf. The results? Less administrative work for you, more convenience for your patients, and the insights you need to drive clinical and financial performance. athenaOne makes patient engagement easy for patients and practices. For example, you can create care gap outreach campaigns, engaging with patients who are due for wellness visits, cancer screenings, or immunizations, which helps your practice drive greater schedule density and succeed in value-based care. Your patients can also proactively book appointments anytime. Patient self-scheduling lets new and returning patients schedule an appointment through your website, patient portal, or a link in email and other channels. To help reduce no-shows, you can easily conduct automated appointment reminder campaigns. Two-way text reminders allow patients to confirm, cancel, or reschedule on the go. Nationwide, eligibility-related issues are one of the main drivers of denied claims. Not here. athenaOne proactively checks eligibility before the appointment and again at check-in. Any missing and inaccurate information is flagged in athenaOne so staff can follow up and prevent a denied claim down the line. Pre-visit check-in tasks are easy for patients to complete ahead of time with athenaOne. Patients can use the paperless online self-check-in via the patient portal, saving time and reducing work for front office staff. When it's almost time for the encounter, clinicians and staff can use the pre-encounter prep feature to complete tasks ahead of time and minimize distractions during the patient visit. And it's easy to do this anytime, anywhere with the athenaOne mobile app. To minimize distractions during the encounter, athenaOne pulls key clinical tasks into the intake process for a clinical staff member to complete. Our top-to-bottom intake workflow supports the natural flow of a patient conversation, and specialists can customize the intake workflow to reflect their preferred process and skip the parts they don't need. Your clinicians and staff can easily comply with value-based care program requirements without adding after-hours work. athenaOne intelligently surfaces care gaps and quality tasks directly in the clinical workflow, provides insight into HCC RAF coding gaps, and helps ensure your patients receive the preventative care they need. You'll also stay informed about program requirements and best practices from our dedicated quality performance team. During the exam, your clinicians want to focus on the patient, not the screen. Our intuitive clinical workflow is designed to increase face time and reduce documentation time. Templates, macros, accelerators, embedded dictation, and even a virtual assistant allow clinicians to document naturally and increase efficiency. Virtual visits are equally seamless thanks to our fully integrated native telehealth solution. athenahealth builds and maintains networked connections with providers, labs, and imaging centers across the country, ensuring the delivery of clean electronic orders and referrals. You can check prescription benefits, see prices, and identify more affordable alternatives in real time. For orders that may require medical authorization, athenaOne's Authorization Management Service determines if an authorization is required and then obtains it on behalf of your practice, saving work and reducing delays in care. When documentation is complete and the encounter is closed, our certified medical coding team jumps into action. Our specialists are supported by artificial intelligence to deliver fast, reliable, accurate coding backed by third-party audits. You can be confident that you're submitting clean claims with athenahealth. Our rules engine is updated continuously, using over 40 million rule permutations to detect claim issues. Our solution automatically flags issues for correction. We proactively resolve as many as we can with zero additional customer involvement. If a claim is denied, athenahealth works to resolve it. From research to claim correction to appeals and resubmission, we work directly with payers to resolve issues around patient insurance, benefits coverage, coding, documentation, and more. To take more work off your plate, we handle remittance tracking and follow-up, and receive and process payments on your behalf. athenahealth is equipped to process paper remittances and electronic transfers, including ERAs and EFTs. Meanwhile, patient engagement continues in the background. For instance, at this stage, lab results from the visit are automatically being posted to the patient portal, and your patient engagement cycle continues. Finally, when your patient has an open balance, athenaHealth issues statements on your behalf. We send self-pay reminders through various channels, and patients can easily pay online. This cycle repeats for every encounter on our network. And because we believe athenaHealth has the largest connected network in healthcare, you can easily understand your performance, benchmark your organization against similar practices, and gain the insights you need to drive continued success.